DC. This is what we do. We take care of the community, and we are very pleased to do that. I want to start by thanking our DC Mayor, Mayor Muriel Bowser. I want to thank Dr. LaQuandra Nesbitt. I want to thank our Fire Chief, Chief John Donnelly. I want to also thank Dr. Robert Coleman for his partnership. We are proud to partner with DC to bring these important vaccinations to the community. And I want to also, and very importantly, recognize the sacrifices of our healthcare workers, of our firefighters, and everyone working on the front line of this pandemic. It is our honor to provide this vaccine to our frontline healthcare workers, and I am ready to get my vaccine when the time comes. I will wait my turn. I want to note that Kaiser Permanente's commitment to health, and specifically the health of our community, is long-standing and enduring. Health to us is more than medical care. Medical care is important, but health is also what you eat and where you live. COVID-19 has really shown us the disparities that impact our communities. And Kaiser Permanente has been, and will be committed to addressing these disparities so that we can all live our lives, we can thrive, and access the American dream. It's important to know that this vaccine is critical to our work to fight the pandemic, and that the vaccine was developed following science. Speed did not sacrifice science. We must help those who are unsure about this vaccine to recognize its safety, its importance in helping us end this pandemic, so that we can return to the things that we all love to do. We can't do it right now, but eventually we will be. In the meantime, we must stay safe. We must remain vigilant by wearing our mask, by social distancing, and avoiding large gatherings and washing our hands. We know that the holidays are going to be difficult because we are social people. We like to get together. We like to get together with those we love. But we also know that this year, staying home is the best way to show your love for your family, your friends, and those you care about. So we can all come together in the future thanks to the sacrifices we are making today. I want to thank you for being here, and now I would like to introduce DC Mayor Muriel Bowser.
Well, good morning, everybody. I'm delighted to be here with you this morning. I want to thank Ruth Williams Brinkley for inviting us to Kaiser Permanente at Capitol Hill, part of the Mid-Atlantic region. And I want to publicly congratulate and welcome you, Ruth. I know you're in a relatively new position here, coming, I think, from another place in the company to lead this Mid-Atlantic region. You will know that I'm very familiar with Kaiser Permanente in the Mid-Atlantic. And we are very grateful that you focus on helping DC residents thrive and live wonderful lives. I'm also very excited to be here with my team, who is doing a really, I just can't tell you how much of a great job that they're doing in keeping DC residents safe throughout our response to this pandemic. I want to acknowledge Dr. LaQuandra Nesbitt and give her a big round of applause. Dr. Nesbitt is our doctor, Ruth, and she is responsible for leading DC Health, but also presenting to our communities and our entire government how we can have healthy people in DC. And you're so right in saying that that includes health care, but it includes everything that impacts our community's well-being. Let me also publicly congratulate for the first time our Chief of the Fire and EMS Department, John Donnelly. Give John A big round of applause. He received his confirmation from the council this week, and we couldn't be prouder of that. Dr. Holman, who leads our EMS, he's the medical director for Fire and EMS, and has been also very ahead of keeping firefighters throughout this COVID response safe. And on the job and well for their families too. So that's my team, and I know there's a huge Kaiser Permanente team that's going to help make this delivery possible. We've come and we're all a little tired of COVID, right? But we can't get too tired of it because we have to crush it, and we're going to need the next few months to do that. And part of that is everybody getting a vaccine when it's their turn. And Dr. Nesbitt has been working hand in hand with our federal partners to make sure that we're ready here in D.C. She has outlined in detail the distribution plan for vaccine in D.C., and Kaiser Permanente is one of our 6 partners that's helping to get the vaccine distributed. And more than that, they are going to be, I think, the primary or maybe the only location for D.C. Fire and EMS to schedule their appointments and come in and be tested. So today, I think we have a few volunteers who are going to show everybody why it's so important to get the vaccine. We're in phase 1A of our distribution, and as you know, that covers healthcare workers, and that's about 80,000 people. Dr. Nesbitt has secured a partnership with the states of Maryland and Virginia to also share some of their vaccine so that we're not just focused on D.C. residents who are healthcare workers, but everybody who comes to our city to support healthcare. And we're very grateful to them for that partnership. So now I'm going to get out of the way. I think that I get to introduce Dr. LaQuandra Nesbitt, who'll say a bit more, followed by Chief Donnelly, and then we'll get on to the vaccinations, and I'll be available for questions in another room.
Thank you, Madam Mayor, and thank you so much for your leadership over the past several months that we've been responding to the pandemic here in Washington, D.C. And I also want to extend a huge thanks to Ms. Williams-Brinkley for her leadership here at Kaiser Permanente. I've had the benefit of knowing Ruth for quite some time, and the partnership that we have with Kaiser Permanente Mid-Atlantic is exactly what we expect under her leadership, to be able to extend this opportunity to serve the community in such a wonderful way, to open up its network, and to be able to serve as a site for vaccinating our first responders and our frontline public health workers. It's such an amazing opportunity that during this first week that the COVID-19 vaccine is available nationwide, that we're able to take care of our first responders who have been providing pre-hospital care since the beginning of this pandemic, to be able to allow them to have access to a vaccine that can confer protection to our population from this disease. We, back in the spring, under the leadership of Mayor Bowser, convened a reopening DC advisory group. And so much of what we discussed is what would it look like, or what would it take for us to get back to our pre-COVID days, to be able to get back to all of those things that we value in our community, in terms of our overall values, in terms of what our economy looked like, in terms of what it would take for us to get back to a place where we were still vigilant about our overall health and well-being, but we could walk around our communities in ways that we were doing this time last year. And so much of that centered around having a vaccine available. But having a vaccine available is not the end game. It's getting vaccinated that is the end game. And so what we're doing here today is expressing to you all what we believe to be a safe and effective vaccine, that when it's your turn to get vaccinated, we want you to have confidence in the vaccine. I have had many discussions with members of my team that say to me, people want to know what Dr. Nesbitt's going to do. Well, Dr. Nesbitt's going to get vaccinated. Dr. Nesbitt has confidence in the vaccine. Dr. Nesbitt has confidence in the processes that exist in the U.S. That allow only products that are safe and effective for the American people. So today I'm going to join our frontline public health workers and join our healthcare workers in the D.C. area in getting vaccinated. So I'd like to now introduce you to our Chief of Fire and Emergency Medical Services in the District of Columbia, Chief Donnelly.
Thank you, Dr. Nesbitt. First, I'd like to start out by saying thank you to the mayor for giving me the opportunity to be the chief, having that confidence in me, and being here today. For all the support for the department, for the frontline workers, to you and Dr. Nesbitt, we have not run out of PPE. Our department has been there to continue to serve the visitors and the residents of the District of Columbia during this pandemic, and we will continue to be there. We believe that this vaccine is going to help us continue to do that. It is very important to us for that reason. I think the most important thing for me to say in all of that is I believe in the vaccine, and that's why I'm getting it today. I want to show all of our members, anybody in the community that may think that there's something wrong with it, it's not safe. I'm going to take it today. I think that's what the message we've heard from everybody else, and I'm actually looking forward to it. This is a great first step on our recovery. And I'm going to introduce Dr. McCarthy. Yes.
Thanks, Chief Donnelly. I'm Dr. Richard McCarthy, and I have the honor of being the medical director of the largest integrated multi-specialty medical group in the D.C., Maryland, and Virginia area, the Mid-Atlantic Permanente Medical Group. And I have the pleasure of working with Ruth Williams Brinkley to deliver the highest quality of care in the area. We're really honored to partner with the DC government to be able to vaccinate our first responders and healthcare workers. And I'd like to start by thanking all of our first responders and all of our healthcare workers for putting themselves on the line, for transforming healthcare both within and outside of Kaiser Permanente for COVID patients. I'm particularly proud at Kaiser Permanente of our virtual home care program, which allows us to take care of COVID patients at home using remote telemedicine and remote data monitoring. I'm also proud of the folks in advanced urgent care here in our 24/7 center at Cap Hill who take care of COVID and non-COVID patients every single day. And I'd like to thank in particular all of the clinical staff here and administrative staff who have made this possible, and the folks who have helped get us the opportunity and the honor to vaccinate KP and non-KP healthcare workers and first responders. I want to reiterate that the vaccine is safe and effective. We're all excited about the vaccine. Both healthcare workers and our country have been through a grueling 9 months, and this is the light at the end of the tunnel. I want to reiterate what other folks have said up here, that this is not the end. We need to continue to practice social distancing. We need to continue to use masks. We need to avoid crowds, especially during the holidays, to keep people safe. It'll be several months before we're able to achieve herd immunity, and we can say finally that COVID-19 is over. I want to introduce some frontline healthcare heroes who are going to be publicly vaccinated. But before I do that, I want to introduce an advanced care nurse, Corey Robinson, who worked for us in our advanced urgent care and now works for us in adult medicine upstairs and has come here to vaccinate all these folks publicly. So I want to give her a round of applause for agreeing to do that. So I would like to introduce first Dr. Nesbitt. Dr. Nesbitt, as you heard, she's a board-certified family practice physician with over a decade of experience leading population health initiatives in governmental public health agencies. Dr. Nesbitt has served as the director of DC Health since January of 2015. In this role, She has reframed the discussion around health equity in Washington, D.C., and broadened the way we think about supporting health and well-being of D.C. residents. Prior to serving as the director of D.C. Health, she served as the director of the Louisville Metro Department of Public Health and Wellness, and I'd like to welcome her and thank her for agreeing to be publicly vaccinated here at Kaiser Permanente. The next person I'd like to introduce is registered nurse Sally Sanhu-Bing. Sally is the clinical operations manager here at Capitol Hill Kaiser Permanente Medical Center for advanced urgent care. She's been a nurse for 15 years and worked for Kaiser Permanente for the last 5 years, and she helps serve all our patients downstairs in our 24/7 urgent care.
Do you have any allergies? No. And do you pass out or faint with needles? No. Do you have any questions about the vaccine? No. Which arm would you like to be vaccinated, right or left? All right.
The next person I'd like to introduce is Dr. Sima Siddiqui. Dr. Sima Siddiqui is a board-certified physician, and she's also the Chief of Service for Advanced Urgent Care in the DC and Suburban Maryland service area, which is our largest service area. Dr. Siddiqui also works for Employee Health in Mid-Atlantic Permanente Medical Group. She's been here for 7 years and has led a lot of transformations in access to advanced urgent care, as well as working with others to achieve 24/7 virtual access within 4 or 5 hours to our doctors in advanced urgent care.
Good morning, Dr. Siddiqui. Good morning, Corey. Can you tell me your month and your day of birth? January 26th. Do you have any allergies to any medication? No. And do you have side effects from needles? No. Do you have any questions about the vaccine? No. Actually, stop for a moment. I need more blanket needles. Somebody can grab me some, and another vaccine. Yeah, the ones that came with the manufacturer don't work. But I do need that. No, so these ones aren't wide enough to close the vaccine.
So while we're waiting, Sima, do you want to talk about some of the changes that were made by your department for COVID?
Yes, since March, we were able to get triage area set up for all patients. We were able to create screening at the doors for all of our members who walk into the building. We were able to test through drive-through testing a lot of our membership. We have also been on the front end of trying to create virtual medical care for members who could not come to the medical office buildings. So it has been a very busy last 9 months.
Yeah, and Sima and the leadership team has achieved a 24-hour turnaround time for our COVID test, which is fantastic, working with the leaders in our lab, and also amazing access in virtual care with, on average, within 4 or 5 hours. You can get a video visit or an in-person visit, if you prefer, with an emergency medicine or family practice doc. So thank you.
Muriel, can you bring me the red one? The red one, pull it up better. So the vaccine is very thick, which is obviously a little bit different than what we're used to. So with red one needles, it's probably the best one.
Okay.
So. We have some over there. So cold. So cold. Yeah.
Yeah, and I also want to thank Corey Robinson. It's hard enough to start giving vaccines, but to do so publicly is a big deal. So thank you very much.
Dr. McCarthy, what I noticed about the vaccine is it's very thick. Unlike the flu vaccine or any other vaccines that we're used to giving, it's a little more thick than the normal vaccines.
So you need a different size needle to pull it out.
Right.
while we're waiting, I also want to recognize Dr. Sheetal Desai, who's the Physician-in-Chief for the DC and suburban Maryland service area, and Dr. Mona Gahunia, who worked with our health plan partners, Haley Park and others, to help us be first vaccinators for the District of Columbia and our other regions. So thank you both for your leadership. The next person I would like to introduce is Lieutenant Keisha Jackson. Keisha Jackson joined the Fire and EMS Department in DC in 2003 and is assigned to the department's Homeland Security Division. Welcome.
The month and the day.
March 6th.
Okay, thank you. Do you have any questions about the vaccine?
No, not right now.
Okay. And do you have any allergies?
No.
And do you faint when you from needles or after vaccination?
No.
No? Okay. Which arm would you prefer, the right or the left?
The right.
The right, okay. Give me a second.
Take your time.
Oh, don't be scared. It's okay. We can both close our eyes. Don't be scared. It's okay. I hear I'm a good stick, and we can talk to it if you want. Look down just a little bit. I'm going to roll your sleeve up. Just have to open the elbow. Question? Do you want a little higher? Okay. So dry out for a second. You're done. You made it. It's okay. Yeah, you're good. You're welcome.
Great. The next person I would like to introduce is Chief John Donnelly, who's the Fire and EMS Chief in Washington, D.C. He started his career with D.C. Fire and Emergency Medical Services in 1992 and was promoted to Chief by Mayor Bowser in September of this year. Congratulations.
Thank you.
He previously served as Assistant Chief, as the Division Commander of Special Operations, Homeland Security, and Apparatus Division, and is a member of the command staff in special projects and executive officer roles.
Chief Donnelly, did you register this morning?
Yes, I did.
Just gotta find you in here.
Nope, I'm not Eric.
Nope, nope, you're not Eric. Nope. Did they give you a temporary medical record number?
No.
I'll take care of it. You'll take care of it? Okay. Do you have any allergies to any medications?
No, ma'am.
No. Okay. And do you faint with needles?
No, ma'am.
No. Do you have any questions about the vaccine?
Nope.
All right. Get the last dose in the first vial.
Ooh. I can hardly wait.
It's too thick, so I'm gonna use a different vial.
Get over. Get read your picture taken so many times.
No, and I'm very hot.
Dr. McCarthy's doing very good at being disinterested.
Thank you for your patience.
Oh, no problem at all. You're going through a lot of needles. You're going through a lot of needles.
I know. Pfizer sent us a lot.
That's good.
Wow. You know, take each one in your right arm.
It's the closest one you
It's the
got.
closest
We'll
one.
we'll make it as easy as we can.
Appreciate you.
Smile.
I can tell you doing it fine.
Don't get used to it. The mayor might.
How did you guys get
Awesome.
time?
Awesome. Didn't even blink.
Muffle it, take ibuprofen, and be on this way to register you for your second appointment.
Okay, thank you.
You're very welcome.
The next person I'd like to introduce is Dr. Robert Coleman. Dr. Coleman began his medical career here in D.C. He attended Georgetown University School of Medicine, completed his chief medical residency there, and then went on to a fellowship in infectious disease at the NIH. He joined the department in February of 2016. Welcome.
You're very welcome. Do you have any allergies? And are you, do you think from, no? Okay. Do you have any questions about the vaccine?
you something, okay?
Okay.
Got it.
You did it already?
I did.
It's easy. Great. Thank you so much.
You're very welcome.
Thank you. And then finally, Lieutenant Joseph Paparillo, who joined Fire and EMS Department in Washington, D.C. in 2003 and is an officer of Engine Company 23 in Foggy Bottom. Welcome.
Corey, are you nurse? Any allergies? No. Would you faint from needles? Perfect. Do you have any questions about the vaccine?
No, ma'am. Who's had the biggest flinch so far?
It's going to be you. We're making history together.
Yes, we are.
You got your arm ready for me?
Yes, ma'am.
Just try to relax a little bit. So one thing with the vaccine is closer to the shoulder. There's a lot of pain, so we go a little further down, okay? 1, 2, 3. Any muscle aches? Try to open.
Thank you.
I want to close by thanking everyone today who agreed to be publicly vaccinated, and also to give a round of applause to the Nurse of the Hour, Corey Robinson, who had to vaccinate everyone in a public setting and did a fantastic job. So thank you very much. And lastly, I want to thank all the first responders and healthcare workers, physician and staff who over the last 9 months have helped keep us safe, keep us healthy, and we're excited that the end is near with this vaccine. So thank you, everyone, and thanks everyone at Capitol Hill who made this possible. Thanks. Thank you.